Yeah, initially there, when we say a diagnosis like cancer or incurable disease like motor neuron disease, patient may have some a thing called denial. They may refuse to accept the diagnosis, and this is common. Our experience that patient keeps doctor shopping, nursing home shopping, and goes here and there and tries his best to find a solution, especially in a country like ours with different streams of medicine like allopathy, homeopathy, Ayurveda. Patient goes everywhere. They are desperate to search for a cure, just like a drowning person will catch hold even of a straw to save his life, though he knows that is not going to save him. Similarly, these patients go here and there, but finally they come back to us when they know that disease cannot be cured. And that is when we have to be honest with them. There is no point in trying to tell them that everything will be fine or I will take care of it. You have to be honest. And in the initial phase, when they are very emotionally upset, we may not be able to say everything. But if we give honest information in small chunks, they will be able to digest that, and then they will be able to plan further. We can explain to them that if they plan their finances, if they plan their family concerns, if they plan their responsibilities well, they can have a good death. In spite of having a bad disease, they can have a good death. There is something called a concept of good death. If that is well explained to the patient, then they can really accept the disease and plan ahead well, and before they die they can do most of their responsibilities can be cleared.
I think the most important part of living with any disease is definitely complying with medical advice. So when the doctors advise certain strategies, it might be a combination usually of drugs as well as some non-pharmacological strategies. The non-pharmacological strategies might include physiotherapy, might include in certain cases some counseling, might include some aerobic activity, some exercise or anything like that. So I think when we plan how to live a life after diagnosis of a chronic crippling illness, we have to comply with medical advice. The advantage is that doing these activities, taking medicines and indulging in other activities will help you to feel good. It will help you to be in control of the situation better. It will help you to plan things better. And I think for certain diseases like psychiatric illnesses, taking those medications and all regularly will prevent relapses, will prevent untoward consequences, because one relapse or one return of symptoms, or in cancer one additional metastasis, has a lot of implications not only for the person but also for the family and for his immediate environment. So I think what is most important is complying with medical advice, being consistent with your behaviors, not being erratic with your medicines, and putting a proper structure in place so that all the pharmacological and non-pharmacological interventions are judiciously followed.
When people are diagnosed with such conditions, the first thing that comes to the mind is, how can it be me? Why me? There are so many millions of people in the world, and why me? And they go into a phase of denial. But it can be anybody. It is better if they are able to accept the disease as early as possible, and then they will be able to live better with whatever number of years they have. Whoever has the disease, he thinks he is only suffering, but everybody in the world is having some or other problem. If not disease, there will be different types of problems. So it is possible to accept the diagnosis, and the health personnel, the doctors, the nurses, the medical students who come in contact with the patient can actually help the patient in accepting the diagnosis, in making them realize that this is the reality. But it is not the end of life. Even people with HIV, AIDS and many other diseases are living quite many years with palliative care. Learn to live with the disease and not let the disease overtake their lives. The disease will be there, the pain, the problems, but if the patients are mentally strong, they will be able to handle the physical pain and the problems, and will be able to live with the disease better.